And then what, for programs that are earlier in their journey or looking to increase that accessibility for survivors who use substances, what are some of the different, resources or tips that might be helpful?
I, I definitely think looking at trainings around those protective capacities and safety and things like that, certainly the resource that you all offer, there's lots of good information there. I think having conversations, sometimes if they're early on or if they're thinking about implementing this might be a good time to do some kind of anonymous exit survey or do some kind of anonymous poll, with your survivors that you're seeing, and whether your shelter or outreach, just see what people are thinking, and do that with the survivors maybe as well as staff. Where are they at in this in this endeavor? Are they, how are they thinking about these issues? What do they think are the concerns, the challenges? And I mean, that might be a good place just to start and see where you're at, and then look for other programs, other partners in your area that share your philosophy. One of the things I think that made that program pretty successful was that I partnered with the local community substance abuse mental health organization, and the therapist I worked with was amazing, and she had a great philosophy, and she really understood the issues. I think finding like-minded individuals that can also still challenge your thinking is super important, and building that in your community so it suits your community. I mean, it's definitely great to look for other resources out and around, but take it back to what works in your community, and what best serves your community, and focus on that too, the micro as well as the macro.
Thank you so much for everything you've shared with us today, Angie. It's been amazing to hear everything that you've done and put in place in your program and the impact it's had. And we just so look forward to learning more from you and hearing from your experience. And thanks everyone for tuning in and listening. We hope that you have gotten a lot out of this and that you will reach out and share with us any kinds of new practices or things you're taking away and trying out in your own program. Thanks so much. Take care.
Thanks. Bye.